I think being observed or being judged or being potentially in that situation where you're not really isn't really a very comfortable experience. And I guess that's a good place to start with respect to how do you get prepared for being in a role where you're actually charged with the observation. There are some things we can do, very effective things that we can do to put at bay some of the concerns that people have with being observed. And that is the beginning of how to set up for good feedback, is how you prepare at the beginning before you actually even start. So I guess that's just the first step. So we know that direct observation and reflection is a very important part of critical thinking and learning. You would all be familiar with the idea that we know well what we don't know if it sits within our view, within our sight, but there is actually areas where we're quite blind about what we don't know. And unless we have people who can provide us with opportunity to reflect on and stretch us beyond what we think we know, we just don't see the areas that we're blind. And that is the most powerful part of having an observer watch and offer you an opportunity to learn in that environment. So NTGPE offers their registrars multiple opportunities for direct observation, and it's part of the mandatory requirement of training in general practice that people have opportunity for this. And in the Northern Territory, because the population of our clientele is largely Aboriginal in the more remote and rural parts of the NT, we have a integrated set of additional things we can offer, which is the observation of our Aboriginal cultural educators within this process. And the cultural educators really value being able to see how registrars are learning within this environment. They value being able to see what their compatriot Aboriginal people are learning and how they're experiencing their healthcare. It's a really insightful thing. And they really value being able to contribute to improvements in the health service and health service provision in this way. So people working in Aboriginal medical services will be offered the opportunity to have a cultural educator and a medical educator together within their observation process. And there is always opportunity afterwards for feedback and teaching. And in fact, one consultation of say 10 or 15 minutes will often lead to discussion that's at least 10 or 15 minutes long, if not half an hour. So in the process of organising these visits, we organise periods of time afterwards for collection of important discussion points. The other thing that does happen automatically in the process of a visit is there are often extraneous things that are going on in a registrar's life and impacting potentially on their capacity to learn on that particular day, or even the setup of what they're doing within their work environment at the time. So another really important part of preparing for where this direct observation visit will go is actually figuring out and the chat that goes on prior to the visit even starting around what's happening in the clinic, what's happening in the surgery, and how is it all going for you. And obviously feedback to and from the supervisor. This is a good prompt for me to actually say that in very early days when I was doing ECT visits, it came across very strongly to me when a supervisor was quite cross that an ECT visitor hadn't actually made the effort to introduce themselves to the supervisor when they arrived at the practice. And I think it's a really important part of our visit to engage professionally with people who are running the practice. So, I mean, that in an Aboriginal medical service environment is just as important. So people need to know that why you're there and what you're there for, and you kind of need to be aware of a bit of the protocol of the place that you're visiting. The last point on this slide is the point of assessment. So trying to provide an opportunity for learning is often challenging if you're also assessing. And clearly registrars are going to think this visit's all about assessment is the first thing that they think. So it's really important when you're the visitor to get in perspective how much of this is about assessment and how much of it is about the registrar learning. And from NTGPE's perspective, it's all about the learning and the opportunity to develop a trusting relationship with someone who can mentor and sort of work in that space. However, you do need to be clear if there is an assessment component involved, and then that takes on a little bit of a different level. And there are some visits, aren't there, that are generated out of reasons of concern, and that needs to be quite clearly outlined when it's going to be like that. But the majority of the visits, am I right, are about teaching and learning and not about assessment. Okay, cool. Any questions about that? So the questions about a protocol around pastoral care and issues, and yes, the NTGPE can provide the resources that we have available for helping out people in difficulties. Yeah, and there's a set sort of flowchart, if you like, of how we go about sorting through those issues.